in this diagram, we see the temporal bone as it has been kind of broken off or separated. Remember that these are suture joints. This would be the squamosal suture joint right here. And so we can see that this bone has a weird irregular shape to it. And it has things that are like protruding, it has holes, it also has processes. So this is actually a really important bone, and all these processes are really important. We did talk about this zygomatic process already, which is part of the temporal bone. We have what is referred to as the mandibular fossa. So if I look at this on my temporal bone, I have the mandibular fossa. And you'll remember that a fossa is a shallow indentation. And so this is where the condylar process of the mandible articulates. So this is where the condylar meaning kind of a round structure, process of the mandible articulates. So this is what makes up the TMJ. And you hear TMJ a lot because people have problems with this joint, but everybody has TMJ. Everybody has a TMJ joint. Some people have problems with it. So they get, for example, inflammation in that could cause their jaw to click, or it could cause pain, or it just could make it very difficult to chew, for example. So when we look at this TMJ, what does that stand for? That is the temporal mandibular joint. So that is where the temporal bone comes together and articulates with the mandible, and this is your jaw joint, right? So this is opening and closing the mouth. This is chewing. So if we go back to a previous diagram, we can see in our diagram here that this is the condylar process of the mandible, and it sits in this the shallow indentation, which is referred to as a fossa. Now, it is important to realize that there are other things that are coming off the mandible. This is actually called the coronoid process. That has a different function than the condylar process. So this right here is your jaw joint. That's your temporal mandibular joint. Let's look at some of the other structures. This is called a styloid process right here. Because it looks like a pen, it is called the styloid process. And this connects via tendons and ligaments to, say, for example, it connects to your hyoid bone. So things connect up here. We have other places that we have styloid processes. So this is the styloid process of the temporal bone. So for example, your radius also has, in your forearm, also has a styloid process. This is oftentimes broken off. So like, for example, in this image, I can't even find where that would be because that has been broken off. It's easily broken off in the skull. Then we have an opening in the bone, and you'll notice that this is right where your ear is. So this is what we call the external acoustic for hearing meatus, and so that's the opening. So sound waves will eventually travel in through there and get into your middle ear. In your middle ear, we have these tiny little bones called ossicles, and you might have heard of them. They're called the incus, the stapes, and the malleus, or the hammer, or they call it anvil and stirrup, right? So those bones would be in there. Okay. There is another bump right here, This bump is actually important. You can feel it when you put your hands behind your ear. So you can feel this bump. And this is an attachment, a place where a muscle attaches. And this is called the mastoid process. So that's the mastoid process. When we look at male and female skulls, the mastoid process tends to be larger because males have larger neck muscles. This sometimes can get infected. You can actually get, it has filled with air. There's some air sacs in there, and you can get infection in there, which can be very, very dangerous because it's very hard for the body to fight an infection when it is located in this region. So this is our the temporal bone and the bone markings that you need to be able to identify.